Hello everyone, I'm Anastasia signing in from NORAS. In our previous session, as we have discussed about the process of bowel elimination, the factors that can affect the bowel elimination pattern of an individual, as well as about the various conditions that can alter this process. In this session, we will be discussing about the nursing management. As a nurse, when we encounter patient with these conditions, it is our responsibility to provide care. So, in order to be able to provide the appropriate care, we must first assess the condition. Here, when we talk about the bowel elimination, then when assessing, what we can do is we can collect the history of the patient. We can perform the physical examination of the rectum, the anus, as well as the colon. And we can also inspect the characteristic of the feces. As in our previous session, we have learned about the normal characteristic. We have come to know the amount, the odor, the consistency, the shape. So here, just by inspecting, we will be able to find out if there is any abnormalities. Not only that, but as a nurse, we must also review the data obtained from relevant diagnostic tests. So here, while collecting the history from the patient, we must make sure that we try to elicit a descriptive information. It is our responsibility to elicit a descriptive information about the usual characteristic of the feces, as well as if the patient has encountered any changes in the recent time. And we must also collect information related to the past or current problems with elimination, if there is presence of ostomy, as well as the factors that can influence the elimination pattern. So as a nurse, you can question the client about their normal pattern. You can question them about the consistency, the shape, whether do they have to strain while they are defecating or whether there is a normal flow, as well as you can question them if there is presence of any blood or mucus in the stool. And you can also question them regarding any current problems which they are finding in their elimination pattern, such as when there is the urge to defecate, but if he or she tries, they may not be able to do so. This can happen in cases of constipation also. So here, as a nurse, you must make sure that when you are collecting the history, you must question all the answers that you need to know, where you will be getting an idea about the condition that he or she is going through. The next, what you can do is you can perform the physical examination. Here, examination of the abdomen can include the inspection, the auscultation, the palpation, and the percussion. However, while doing so, it is preferable that auscultation must be done instead of palpation, as this can alter the peristalsis. When it comes to the examination of the rectum and the anus, here you can perform the inspection and the palpation. You can also inspect the feces where you will be able to note the amount, the odor, the shape, the consistency, as well as if there is presence of any abnormal constituents. So again, for this, you must know the normal characteristic, then only you will be able to detect the presence of abnormality. Various diagnostic studies of the gastrointestinal tract can also be performed, which can include the direct visualization technique, the indirect visualization technique, as well as the other lab tests in order to find out the presence of abnormality. Here, as we know that there are various visualization technique which we can do in order to visualize the gastrointestinal tract, which can include the colostomy, the sigmoidoscopy, as well as the anoscopy. Here, various diagnostic studies, depending on the condition of the patient, can also be performed in order to detect the cause or in order to detect the condition that the person is suffering from. Coming to the diagnosis, here the Nanda International includes the following diagnostic labels for fecal impaction, that is the bowel incontinence, constipation, risk for constipation, perceived constipation, diarrhea, as well as dysfunctional gastrointestinal motility. So here, while diagnosing the condition of the patient, according to the Nanda diagnosis, these can be some of the factors. Now, in order to get a clear idea of what are the factors that can occur in a person, as well as what are the other factors that can be related as well, let us discuss about the diagnosis along with the related factors in detail. So these are the various problems that can be listed according to the Nanda diagnosis. So here, in order to get a clear idea of the problem and the related factors, let us discuss about the diagnosis in detail. As we know that the presence of the fecal elimination problem can also affect all the other areas of human functioning, and as a consequence it can also result as the etiology of the Nanda diagnosis. So here we will look at few of the examples where this consequence may lead to becoming the etiology of the diagnosis. The first one is risk for deficit fluid volume or risk for electrolyte imbalance, which can be related to prolonged diarrhea or even to abnormal fluid loss through ostomy. So here, if a person is having diarrhea for a long duration of time, or if a person is having an abnormal fluid loss from the body because of ostomy, then this can lead to risk for deficit fluid volume or even risk for electrolyte imbalance. Here, the problem will be the risk for deficit fluid volume, and the causative factor may be the prolonged diarrhea or even the abnormal fluid loss. The second can be risk for impaired skin integrity, which can be related to prolonged diarrhea, to the presence of bowel incontinence, or even because of the bowel diversion ostomy. The third can be the situational low self-esteem, which can be related to ostomy, which can be related to fecal incontinence, or even to the need for assistance while toileting. The fourth can be disturbed body image related to the presence of ostomy or even to the presence of bowel incontinence. Deficit knowledge can also be one of the problem that is related to lack of previous experience. So here, if one has never experienced this condition, then it is very common that he or she might not have the adequate knowledge related to that condition. So because of this, it can lead to diagnosis noted as the deficit knowledge related to lack of previous experience. There can also be presence of anxiety where the patient might become anxious because of the condition he or she is suffering from. So here we can state it as anxiety related to lack of control of fecal elimination secondary to ostomy, or even related to response of others to ostomy. So these are few of the examples that we can state in the nursing diagnosis if a person is suffering from an altered bowel elimination. Here, depending on the condition, you will also be stating the diagnosis, because it is only after stating the diagnosis we can then plan as well as implement the actions or implement the treatment. Moving on to the next is the planning. So here, after the diagnosis has been stated, what we must do next is we must plan. So for the patients who are suffering from fecal elimination problem, it is very common that our goals will be to maintain or to restore their normal elimination pattern, to maintain or regain the normal consistency of the stool, to prevent the occurrence of any associated risk, which can be the fluid and electrolyte imbalance, which can be the dehydration, the abdominal distension, or even pain. So in order to plan it well as to achieve the goals, it is very important that appropriate preventive as well as corrective nursing intervention that is related to this condition must be first identified. So once this is identified, then we can choose the specific nursing activities for which it would help that particular patient to cure from their condition. So once this is identified, we must then select which is to be implemented according to the needs of the patient. While planning, if the patient is in the hospital itself, then you can plan it accordingly. Whereas if the patient is in the home setting, then even for these, a separate plan for home care must be done. For clients who have bowel diversion ostomy or who wears pouches, or for those who is having an ongoing elimination problem, then plan must be done according to the condition of the patient so that even in their home setting an appropriate care can be provided. Here comes the major responsibility of a nurse. The nurse must make sure that the client and the family members will be able to meet up to the expectation, will be able to deliver the specific needs of the patient, because it is only after this is assured we will be able to discharge the patient. If this is not assured, then it is advisable that the patient must be kept in the hospital itself so that the care will not be interrupted. Now, the next step is implementing. As a nurse, after we have diagnosed the condition, after we have planned, the next step is the implementation. Here, the main goal for us to help the patient promote a regular defecation. So, in order to help them in this, we need to attend to their provision of privacy, whereby we need to provide privacy to the patient while they are defecating. We also need to attend to the timings, that is the bowel training. So here the timing plays a major role, because if the patient has had this bowel training since their childhood, then it becomes very easy. He or she will be having this urge of defecation in a particular time. But if he or she does not follow the bowel training method, then we must advise them to do so. We must also make sure that the time which they defecate or which they try this process must be convenient and favorable to them. We must also attend to their nutrition and fluids, because it is only if they are consuming large amount of fluid, only if they are consuming high fiber diet, then problems will not be arising. The next is the performance of exercise. Here it is very important that each and every individual must perform regular exercises, especially for patients. It is important that they perform the Kegel exercise, which would help them in this process, as well as positioning. Here, as we know that squatting is a position that one must take for the facilitation of the bowel elimination. So by taking a proper position, it will also help to promote regular defecation. So here, not only this, but as a nurse, you must also educate the patient about the medications. Here, if a person is suffering from any elimination problems, then we can provide the laxative, the cathartics, or even the antidiarrheal and the anti-flatulent medications. As we know that cathartics are drugs that can be used in order to induce defecation, and that they also have a strong purgative effect. However, a laxative is milder in comparison to the cathartic drugs, so this will be highly recommended, because this will just make the stool soft or liquid, and in this manner it will lead to an easy passage of the stool. However, this laxative is also contraindicated in patients having nausea, vomiting, colic, or even an undiagnosed abdominal pain. Not only that, but this laxative also has several side effects. Here, continual or chronic use of laxative can decrease the ability to voluntarily control the act of defecation. So if a person complains of having constipation, what we can do is, instead of just providing a laxative or a cathartics, what we can do is we can educate them of taking food which is high in fiber. We can educate them about the importance of drinking large amount of fluids, about the importance of regularly performing exercises, and also following a regular defecation habits, because by doing this it can also help them to to have a normal elimination pattern. Only after these have been followed, and if you find that there is still no improvement, then cathartics or laxative may be prescribed. Whereas the antidiarrheal medications can also be prescribed mainly for those patients who is having the complaint of diarrhea, because these are the medications which would slow down the motility of the intestine. So once the motility is slowed down, there will also be a decrease in the peristalsis, and this would ultimately resolve the problem of diarrhea. And the last one is the anti-flatulent medications. These anti-flatulent agents does not decrease the formation of the flatus. However, they help in the passage of this flatus from the intestine by belching through the mouth or expulsion through the anus. These are the various things that a nurse can do or can help the patient manage their condition. So now here we have come to the end of this topic. I hope you have got a clear understanding of this session. I'll be meeting you in my next session. Until then, have a good day. Thank you.